Hello GIC, greetings from southwest Uganda. Hope you're having a good conference. Hoping just to speak to you briefly about my work here with my wife Sarah, and want to extend our greetings to Robin and Shazia and Merlin and Hamish if he's there, and everyone, all the delegates. Hope you'll have a good day. We were asked to maybe present some information to you about GPs that are working in the field, and what we're hoping to do is maybe talk a little bit about Bwindi Community Hospital, and we're wanting to start off here at the entrance, so that's what we're going to do just now. The hospital itself has about 120 beds. It's just coming up for 10 years old, and it serves the people from a population area of about 100,000 in the Kanungu district of southwest Uganda. It has all sorts of diseases, as you would imagine, and HIV rates are about 7% here, TB rates about 8%, and life expectancy is about 50 years old. There's several other health indicators that I could share with you, but that's what I wanted to communicate just now. And what we're going to do is walk around the hospital, and I'm going to show what we do in the hospital, and hopefully that will be interesting for you. And then maybe at the end, if I'm available, if the internet's working, we can have a Skype conversation. So hope this works out, and hope you have a good day. Bye. So this is the outpatient department. It sees people every day of the week, apart from Sunday, and as you can see there are different rooms. This is the registration room, and then there's the drugs room where people get their prescriptions, and then there's 3 consulting rooms. One is dentistry and 2 are outpatients, just like we have back in the UK. So this is where we spend some of our time, and what we do is we assist the clinical officers here, who are a bit like medical doctors, and they see most of the outpatients, so they call myself or Sarah when there's an interesting or complicated case. Okay, so this is adult inpatients here. It's where we see a lot of the people that have been referred in from outpatients, but sometimes they're carried in from stretchers from the community. I'm based here mainly, so there's about 20 beds. It has male and female, has a wide variety of conditions, things like infectious diseases, malaria, TB, HIV, through to the more chronic things, such as gastritis or diarrheal diseases that you might even see back home. Like that. So this is our staff room, and as you can see this is Denari and Midias, and these are 2 of our several nurses that work here. They are now movie stars, and they want to have their own agents so they can work in Hollywood. They do a very good job, they work very hard, and they keep me right. So this is the adult inpatients. We're in the ward now. This is the male side of the ward. So we've got most of the ward full at the moment. We've got several different conditions in, from let's say the more common ones such as gastric problems through to some quite difficult cases to manage. There's 3 isolation rooms to the left which are off camera, and we sometimes use those if patients have conditions such as TB that they want to isolate from other patients. So this is home sweet home, and happy to share it with you. So this is the corridor that we've just walked off of. We've just left adult inpatients and we're now going to paediatrics, but just wanted to stop and share this view simply because it's absolutely gorgeous. You can see some of the other buildings in the hospital, so we'll go up here just now and walk. Welcome to paediatrics. This is one of the newer buildings in the hospital, and it has 40 beds altogether, about 30 for children and about 10 for the neonates. You can see the main ward behind me, and there's some coughing, there's some spluttering, there's a little bit of crying. Generally it's a very happy place. To my left there's the isolation beds when some children are sick, and there's another area for neonates as well that they keep them, the young ones that are struggling, warm and give them sort of full active care. I'm going to introduce you to the staff here, and they're over to my left, so we go to your left and we can meet them just now. Gertrude, good to meet you. Say hello. This is Gertrude. She's our expert singer. She's in the choir. She was singing this morning, and she's putting information at the moment on the computer. The hospital has an electronic record system, which is very impressive. It also has a server, and there's a Wi-Fi, so they can communicate with the records from remote terminals. So very, very impressive indeed. And she's on duty this evening, so looking after the children in the ward. So now we're in the neonate area. As you can see, there's different beds. There's the sort of more sort of technologically advanced incubators that we might be used to in the United Kingdom, and on this side there's more sort of traditional cots for the children that aren't quite as unwell. Often there'll be mothers in here with the children, so there's always someone about, but just now it's quiet. So this area is visited every day, and all the protocols are on the wall, and as you can see there's instruments that are specific for neonates, so the kit is here.
Brenda, I'm a nurse, a diploma nurse working in children's ward, and children's ward here we have a HDU unit. This is a high dependency unit. We have there only one bed. It is a small room as you see. And currently we have a neonate of 12 days. He's very sick, as you see, and we are putting in a special unit. Currently, the baby has been here for 3 days, and we see some slight improvement.
Great, so we've now reached the postnatal ward. As you can see, there's some beds around, some patients here, and you can see the hospital uses quite a lot of imagery to convey public health messages. So you've got a picture behind me of a woman sleeping underneath the bed there with a child, and that's along with the care that's happening in the hospital. The primary care is a huge aspect, and it's helping reduce infant and maternal mortality rates. So I'll take you through now to the next area. So now we've arrived in the more surgical part of the hospital, and as you can see with the walls and the beds around me, this is the maternity area, the delivery suite. There's some beds behind the camera as well. This is an area used. It's a massive issue to keep things as clean as possible, so that's what the staff try to do, and that's also part of the big picture, trying to reduce maternal and child mortality. So we're just leaving maternity. The thing that I wanted to demonstrate or really emphasise is that there's a massive boost in family planning here as well. So that's taken care of by the nursing staff, and there's actually a lot of community outreach with family planning, so reaching people where they are in their villages so that the barriers to getting effective contraception as low as possible. Okay, so now we've reached the waiting mothers hostel, which is a fascinating aspect of Bwindi because it's really reaching into the why that mothers dying. And a huge issue is mothers not having access to healthcare, whereas here they can come and stay for as long as they need to, and essentially this becomes their home, and it means that when they reach their term, when the waters break, they get immediate access to the hospital facilities, and this is there's a huge part of this that's reducing maternal mortality in our area.
You have to open it and give it. You open it and they can...
I'm sure you can.
Probably you can. It's only...
Welcome to our home in Bwindi on this beautiful morning. It's about 7:15 in the morning, and I'm just showing you where we live here behind me. We've got the staff quarters here and some of our staff members getting ready for work for the day. I love living here, it's a beautiful place. You can hear the sound of water in the background and birds. When we have time off, I'm just going to show you as we walk around the staff quarters. There's some hills at the back here. And this is the very edge of Bwindi impenetrable forest that you can maybe just about make out. So we walk just to the edge of the forest, and there's something called the Backward Development Programme, which is where they help the most deprived members of the community to earn a living through tours of how they used to live in the forest, and a nice trail up there. And then if we move round, we're going back down the path. You can't see it, it's just there towards the hospital, and then another hill at the back. So we're just going to go all the way around and back to the staff quarters, just on our right here. So yeah, in our off days we climb up the hills and do some walking, spend time with the community, the staff members here. It is a very small community, but very supportive and friendly and welcoming.
So good morning. As you can note by the slight attire change, it's a new day, and we're just about to go and visit the District Health Officer. Wanted to really finish up our tour of the hospital at this building, the Equality, which is behind me. And the reason I think it's quite important is because the hospital has started a very strong primary care sort of community health campaign. It's been going for a few years, and it essentially registers people from the community up to about 30,000 now. And what that does is it gives them a reduced rate of subscription annually, so it means that they only pay the equivalent of about 25 pence to be a member of insurance for the hospital. And what that does is it gives some running costs to the hospital, but more even than that is actually it changes people's health seeking behaviour. So the work that we do in outpatient clinic, which is like GP, which is 80% of the hospital's patient attendance, is actually through that scheme now, because people are aware that they're not going to get economic catastrophe, so therefore they'll present earlier and they can treat people, and that includes long-term conditions such as epilepsy, mental health, hypertension, heart failure. So it really has built in a new way of care for local people. I'd like to say also that our work here there's hospital-based work that you've seen, there's primary care-based work that you've seen, which is the outpatients, but we've also got non-clinical work such as the confidential inquiry that Dr. Mellon will be talking about, and some work with family planning, alcohol sort of improvement and activity, because it's an issue. So hopefully that's an overview of Bwindi Community Hospital. Hopefully there might be some questions to share at the Skype, and what I would like to say is that there will be an opportunity if anyone's interested. We're looking to really build in sustainability to this project with the likes of UK doctors, and the hospital board have agreed that that would be something that they would want. So from about August 2014 there would be a real need or an opportunity perhaps for anyone that would want to come over here and spend, I'd say minimum 6 months. The hospital are hoping for closer to a year, but for someone to come and really continue the work that's been started. So Hamish will be there to talk about it, Dr. Mellon will be there as well, and hope you have a great conference. Thank you for the work of the GIC, thank you for all the board members on it that make it happen, and thank you for all your support to give the members such a strong mandate to do good work. So have a good day.